Every 66 seconds, another person in this nation receives a dementia diagnosis. By the conclusion of this presentation, roughly 24 additional families will hear those words. Yet for some of them, the years aren't the real culprit. It's a container of medication sitting on their nightstand, something they've been assured carries no danger. I'm Dr. William Lee. Throughout my extensive career, I've witnessed the same pattern repeatedly. Someone maintains mental sharpness throughout their life, then gradually deteriorates. Forgotten names, misplaced appointments, familiar routes becoming confusing. Everyone presumes it's simply aging. It wasn't. It was medication. Something nobody generally questions since a physician authorized it and a pharmacy dispensed it routinely. Contemporary investigation keeps validating something concerning. One standard everyday medication category can severely compromise cognitive function within 12 months. Before proceeding further with the remaining medications, I want to share something genuinely transforming how people protect their independence. I've developed a comprehensive resource called Stand Strong, the doctor's fall-proof method for life after 70. It's specifically designed to enhance your leg strength, strengthen your balance capacity, boost your everyday physical capability, meaningfully decrease incident probability, and maintain your full independence throughout upcoming decades. This practical guide incorporates movement protocols and daily routines that simply cannot receive adequate coverage in a solitary video presentation. What you're learning currently represents core nutritional and pharmaceutical information, while this ebook delivers your comprehensive individualized system for enduring results. You can obtain it through the link in my pinned comment or directly within the video description. Yet most individuals consuming it remain unaware this is occurring. Currently, I'm presenting 9 pharmaceutical agents most substantially associated with cognitive deterioration. I'm ranking them from those that operate invisibly to the one I regard as profoundly harmful. Pay particular consideration to number 3. It's given to millions of older individuals for something appearing completely benign, and it may be reducing your brain's memory regions right now without generating any apparent symptoms. Before continuing further, please share your current age and your regular medications in the comments section. I engage with every response, and understanding this audience's age demographic influences my upcoming material. Let's begin at number 9. Don't misconstrue its position as insignificance, because this substance occupies nearly every household's medication collection in this nation. Number 9 is diphenhydramine. You probably recognize it through its retail designation, Benadryl. It's that familiar pink tablet taken to facilitate sleep, manage allergic responses, or reduce cold discomfort. It's inexpensive, available without restrictions, and since prescriptions aren't necessary, most individuals believe it must be innocuous. Within your brain, however, a remarkably distinct mechanism operates. Diphenhydramine belongs to a pharmaceutical classification termed anticholinergic, fundamentally a classification describing a straightforward action. These substances inhibit acetylcholine, a neural messenger your brain employs to establish novel memories and sustain daily alertness. With advancing years, the brain generates progressively less of this chemical and becomes increasingly dependent on remaining supplies. Consequently, a substance blocking it damages a septuagenarian's cognitive function far more severely than a 30-year-old's. The structure bearing the greatest impact represents the hippocampus, the modest curved brain region where new memories originate before getting relocated elsewhere. Throughout my professional experience, I've encountered individuals taking bedtime antihistamine formulations consistently over extended periods and gradually observing mental decline, yet never attributing the haziness to the tablet adjacent to their pillow. Scientific evidence communicates clearly about this phenomenon. A 2023 investigation through the Journal of Geriatric Cognitive Health examined older individuals consuming anticholinergic medications regularly and identified a 54% elevated dementia probability compared to non-consumers. That exceeds half again the baseline probability from something most individuals consume casually. What should you implement? Examine the packaging on anything you ingest for sleep and anything labeled PM, overnight acting, or anti-allergy, since these frequently contain diphenhydramine under different marketing names. Should you use it for allergies, contemporary antihistamine options, including loratadine, marketed as Claritin, don't penetrate your brain tissue the manner diphenhydramine does and present substantially superior long-term protection. Never discontinue medication independently. Initiate this discussion with your healthcare provider initially. However, stop accepting that non-prescription automatically means safe regarding memory preservation. That concludes number 9. Number 8 involves something benefiting your digestive system while your brain carries the hidden expense. Number 8 consists of proton pump inhibitors. Prevalent names include omeprazole, marketed as Prilosec, and esomeprazole, marketed as Nexium. These medications reduce stomach acid generation and receive approval for acid reflux, heartburn, and postprandial discomfort. People maintain these treatments throughout extended periods, occasionally decades, because discontinuing them frequently triggers symptom recurrence. This creates an impression that the medication represents the sole mechanism maintaining stability. Here's what most pharmacy counselors never communicate. Your digestive system requires acid to extract particular nutrients from consumed foods. Foremost among these is vitamin B12, which maintains neural and psychological health. Substantially decreasing acid for prolonged periods causes B12 to gradually diminish. Magnesium and calcium similarly decline, two elements your neurons require for appropriate activation and signaling. Deprive neurons of these, and you experience misfiring, confusion, and cognitive lapses resembling early-stage Alzheimer's. Yet the genuine reason involves nutrients your medication has systematically blocked throughout this entire duration. A 2016 investigation published in JAMA Neurology examined more than 73,000 individuals aged 75 and above. Consistent PPI consumers demonstrated a 44% heightened dementia probability compared to non-consumers. Additionally, research demonstrates that PP is amplify amyloid beta concentration within the brain, that troublesome protein accumulating in Alzheimer's pathology. So what's the recommendation? Should you consume a PPI daily? That warrants discussion with your healthcare provider. Numerous individuals can transition to a gentler medication classification designated H2 antagonists, such as famotidine marketed as Pepcid, which causes substantially reduced cognitive consequences. Consuming deglycyrrhizinated licorice, a botanical substance that protects and calms stomach tissue, may alleviate symptoms without affecting psychological function. The optimal approach involves the minimum dose spanning the shortest time frame, not perpetual consumption merely from routine. Number 7 addresses a condition most individuals prefer keeping confidential. Number 7 comprises overactive bladder pharmaceuticals, and the particular one warranting attention carries the designation oxybutynin, marketed as Ditropan. It's administered to older adults experiencing sudden, compelling bathroom necessity, that category of urgent bladder sensitivity that disrupts entire days. The assistance it provides genuinely exists, and the humiliation it spares carries genuine significance. However, oxybutynin operates by suppressing acetylcholine, identical to diphenhydramine's mechanism. This substance penetrates your brain readily, settling precisely within memory formation zones. That positions it among the riskier entries on the present catalog for older individuals, particularly following sustained application over extended years. A 2019 investigation via the British Medical Journal studied individuals above 65 taking potent anticholinergic substances like oxybutynin, for durations exceeding 12 months. Their dementia probability climbed 49% higher, approaching 1 in 2 probability. What deeply disturbs me involves this reality. Practically none received advance notice. They received assurance that medication would regulate bladder symptoms. Nobody cautioned they might simultaneously diminish psychological clarity. The cognitive fog subsequently gets attributed to aging. Individuals describe overlooking appointments, repeatedly misplacing items, losing conversational threads, and surrounding individuals acknowledge, well, advancing years happen. Rarely does investigation connect this to pharmaceutical intervention until considerable cognitive loss has transpired. Should you consume oxybutynin and identified memory deterioration, consider this significant because you don't have to sacrifice either bladder regulation or psychological function. Pharmaceutical alternatives, including mirabegron, marketed as Myrbetriq, operate through entirely separate mechanisms and don't suppress acetylcholine. Most older individuals experience comparable symptom control with substantially diminished neurological danger. Discuss this possibility at your subsequent appointment. Thousands have previously invested in this approach, establishing it as the definitive resource for individuals across 60 committed to remaining capable and autonomous. Now let's continue examining the remaining medications. Number 6 possibly represents this list's most shocking entry, considering it constitutes one of Earth's most universally prescribed medications. Number 6 encompasses statins. Simvastatin and atorvastatin, marketed as Zocor and Lipitor, represent pharmaceutical industry bestsellers, particularly beyond age 60, and they accomplish significant work decreasing cholesterol and diminishing cardiovascular incident and stroke probability. Statins appropriately belong in numerous individuals' medication regimens, and this discussion doesn't challenge that appropriateness. What follows constitutes the portion of the narrative typically omitted. Cholesterol influences significantly more than cardiac function. Your brain comprises nearly 60% lipids and depends on cholesterol for generating myelin, that protective covering wrapping neural pathways so transmission occurs efficiently and clearly. Reducing cholesterol excessively using powerful statin formulations may leave the brain insufficient for genuine neurological requirements. The statins generating maximum cognitive trouble include formulations readily crossing into brain architecture. A 2023 investigation within Frontiers in Aging Neuroscience discovered that individuals above 70 utilizing statins for durations beyond 3 years demonstrated a 26% amplified mild cognitive impairment frequency. Dosage escalation correlates with accelerated deterioration. Certain patients experience unsettling discontinuities. Familiar nomenclature becomes inaccessible. Recently finished conversation gets forgotten. Routes traversed for decades suddenly seem unfamiliar. Importantly, not every statin formulation affects neural function identically. Pravastatin and rosuvastatin don't cross into neural tissue similarly and generally represent safer alternatives for preserving psychological abilities. Therefore, should you've implemented statin therapy for extended periods and notice increasing haziness, forgetfulness, or psychological confusion, that merits authentic discussion with your healthcare provider regarding dose reduction or alternative formulations. It doesn't justify quietly abandoning medication, potentially preserving your cardiovascular health. Establish the correct approach with professional guidance exclusively, never autonomously. Brief interruption. Should this information clarify connections for you, activate the appreciation feature momentarily. It genuinely facilitates this content, reaching greater numbers of older individuals requiring it. Additionally, communicate your current medication quantity in the response section. I genuinely examine all feedback. Continuing with the countdown. Number 5 encompasses benzodiazepines. Lorazepam marketed as Ativan, diazepam marketed as Valium, alprazolam marketed as Xanax. These represent among America's regularly prescribed pharmaceuticals for psychological distress and sleep disturbance. They function by amplifying GABA, your brain's organic calming signal, regulating an hyperactive nervous system. Initially, these can appear genuinely beneficial. Panic subsides, mental racing diminishes, restful slumber happens. However, the situation transforms progressively. A 2022 investigation within the British Medical Journal monitored approximately 8,000 older individuals across 6-year spans and discovered that those consuming benzodiazepines beyond 3-year durations experienced 51% heightened Alzheimer's probability. Extended action formulations, including diazepam, demonstrated amplified danger because they remain circulating longer and concentrate within body lipids, incorporating the brain. These pharmaceuticals generate gradual, widespread neural suppression. Information absorption slows. Psychological adaptability diminishes. Numerous individuals characterize an emotional disconnection resembling movement through mist, no longer experiencing their authentic selves. The most difficult element involves discontinuation. Should benzodiazepines stop suddenly, psychological distress and insomnia regularly resurface, occasionally intensified, accompanied by agitation, potentially becoming hazardous. This renders the medication seem indispensable precisely when it produces maximal neurological injury. Therefore, here's the essential principle. Should benzodiazepine therapy has persisted beyond several weeks, never cease abruptly, since this constitutes genuine danger. Partner with your healthcare provider implementing progressive reduction spanning weeks or longer. Gentler selections exist. Buspirone successfully reduces anxiety without sedation or neural impairment. Additionally, specialized psychological approaches, specifically targeting insomnia and psychological distress, can reestablish tranquility without cognitive consequences. Now let's transition to number 4. Number 4 comprises one medication prescribed for 3 distinct complications, yet conveys one of this enumeration's maximum concealed neurological damage. Number 4 is amitriptyline, marketed as Elavil. It's an historical anti-mood disorder pharmaceutical remaining broadly administered presently for neurological discomfort, rest impairment, and even headache avoidance. That adaptability precisely explains its prevalence. It seems like one tablet addressing everything, yet essentially it represents one of contemporary medicine's most potent anticholinergic formulations. That means it powerfully suppresses acetylcholine, the neurochemical your neurons require for interaction and recent memory formation. It suppresses acetylcholine so thoroughly that extended consumption transforms memory problems from unusual adverse reactions to anticipated consequences. A 2015 investigation through JAMA Internal Medicine examined over 3,400 individuals aged 65 and beyond, individuals demonstrating the greatest cumulative anticholinergic pharmaceutical exposure, including amitriptyline, throughout a 10-year span, possessed 54% amplified dementia probability. Practically none received earlier caution that medication could accomplish this. They received prescriptions addressing slumber or discomfort, then progressively recognized vocabulary becoming unavailable, recollections thinning, concentration weakening, and simply ascribed this to advancing decades. It doesn't necessitate substantial quantities. A modest nocturnal quantity sustained across years can progressively compromise psychological function without perceptible initial symptoms until harm becomes considerable. Should you or someone near you utilizes amitriptyline, that conversation merits happening immediately. For neurological discomfort, substitutes including duloxetine or gabapentin might supply comparable alleviation without equivalent anticholinergic consequence. Regarding sleep, melatonin, or minimal dosapine doses, substantially gentler regarding this neurochemical system might serve as replacements. Concerning psychological conditions, contemporary anti-mood pharmaceuticals, including sertraline and citalopram, generally represent substantially superior long-term psychological health alternatives. Number 3 constitutes the entry I identified previously because it's given to numerous individuals for something appearing completely safe. Number 3 is paroxetine marketed as Paxil. It constitutes one among Earth's frequently administered components of an anti-mood pharmaceutical classification designated SSRIs. Usage spans psychological depression and psychological distress. Outwardly, it seems contemporary and gentle, substantially kinder compared to numerous historical psychiatric agents. Yet here's the overlooked element. Paroxetine represents the exclusive SSRI, displaying substantial anticholinergic properties. That single quality distinguishes it from comparable medications, including sertraline and citalopram, because it disrupts the equivalent acetylcholine mechanism every other pharmaceutical on this enumeration has been disrupting. A 2021 extensive analysis in Frontiers in Psychiatry examined older individuals consuming distinct SSRIs and discovered that paroxetine consumers demonstrated observable short-term memory reduction, word retrieval difficulties, and concentration diminishment within the initial 12 months. Older individuals consuming paroxetine manifested 30% heightened early cognitive impairment probability compared to individuals receiving alternative anti-mood medications. There's a tragic paradox inherent here. The medication receives authorization for psychological stabilization, yet gradually it corrodes the psychological lucidity it was supposed to safeguard. The answer here proves uncomplicated. In older populations, paroxetine generally warrants circumvention when substitutes remain accessible. The American Association of Geriatric Medicine established it within their cautionary listing, a recognized compilation of pharmaceuticals deemed possibly unsuitable for older adults. Paroxetine appears precisely for these explanations. Should you utilize it, communicate with your healthcare provider regarding switching toward a safer SSRI, including sertraline or citalopram, which demonstrate reduced danger and lack identical neurological hazards. Sustaining sufficient B-complex quantities, specifically B12 and B6, might additionally bolster psychological wellness throughout these modifications. Number 2 receives authorization so discreetly that numerous individuals consuming it remain unaware of its pharmaceutical classification. Number 2 encompasses antipsychotic medications. That particular category genuinely troubles me because numerous individuals consuming these substances never deliberately decided to accept antipsychotics. Classifications encompass quetiapine marketed as Seroquel, risperidone marketed as Risperdal, and olanzapine marketed as Zyprexa. These pharmaceuticals initially received approval for severe psychological diseases, including schizophrenia and bipolar circumstances. Presently, they're routinely recommended outside official authorization to older individuals for sleeping disturbance, mild psychological agitation, or behavioral turbulence accompanying memory decline itself. Intensive psychiatric medications created for serious disorders now regularly feature in residences and facilities for older individuals who remain simply bewildered, agitated, or taxing for understaffed care providers. Expense can prove substantial. A 2022 investigation within Lancet Healthy Longevity examined approximately 25,000 older individuals and discovered that those administered antipsychotics addressing behavioral manifestations experienced 71% amplified cognitive deterioration probability within 12 months, regardless of prior dementia absence. These substances additionally amplify stroke probability, sudden cardiac demise likelihood, and intense sedation promoting incidence and healthcare admissions. They function by diminishing dopamine, a neurochemical associated not exclusively with psychological stability, but equally with concentration, preparation, and recollection. Diminish dopamine sufficiently, and the brain responds gradually and weakly. That explains why certain individuals on these substances seem dull, emotionally vacant, or psychologically distant, while their relatives grieve the imperceptible disappearance of someone physically remaining. Should you or a cherished individual consume these substances, the preliminary phase involves requesting your prescribing healthcare professional one direct inquiry. What purpose motivated this authorization, and remains it genuinely required, or primarily for practicality? Numerous behavioral manifestations frequently ameliorate without pharmaceutical intervention via dependable daily frameworks, decreased noise and overstimulation, managing unidentified discomfort, and improved sleep and environmental illumination. When pharmaceutical intervention genuinely remains necessary, the minimum productive quantity spanning the shortest duration assists in mitigating damage. Regrettably, numerous families receive no instruction regarding these substances' neural consequences. They witness deterioration they presume constitutes normal aging when the authentic mechanism represents pharmacological effects. Finally, we arrive at number one. Number one doesn't represent singular medication, and it potentially constitutes the concealed most powerful cause underlying every narrative addressed presently. Number one encompasses anticholinergic pharmaceutical load. It's the peril practically nobody discusses, and it possibly ranks among medicine-generated memory reduction's principal causes in older populations. You probably anticipated one concluding villain, one singular most dangerous pharmaceutical. Reality proves additional complexity. Maximum danger frequently develops from progressive buildup of numerous anticholinergic medications consumed simultaneously with nobody monitoring comprehensive load. Polypharmacy fundamentally means consuming numerous medications concurrently. Anticholinergic burden describes all those medications' combined suppression of equivalent memory-influencing neurochemicals concurrently. Contemplate an ordinary scenario. An older individual consumes diphenhydramine nightly for sleeping, oxybutynin continuously for bladder regulation, plus amitriptyline for neurological discomfort. Autonomously, every substance might generate minimal, scarcely perceptible consequence. Collectively, however, consequences accumulate and neural suppression escalates quickly. A 2022 investigation in Age and Aging examined over 280,000 older individuals and discovered that individuals carrying the maximum anticholinergic load manifested 120% elevated dementia probability throughout 10 years, exceeding doubled danger. The substantial proportion remained unaware they were consuming anticholinergic pharmaceuticals. Nobody had clarified this. Whenever acetylcholine faces suppression simultaneously through numerous directions, the brain doesn't merely slow. Nerve cells can deteriorate from inadequate utilization. Neural pathways may contract, and the brain settles into a subdued, diminished condition closely resembling Alzheimer's manifestation on cognitive examination. Communicate within the comments section and communicate you'll schedule pharmaceutical review this week. Your response possibly constitutes exactly what assists the subsequent reader. And preceding departure, one additional location, your physical form, conceals communications. Your medication collection constitutes one area. Your hands constitute another. Your fingernails exhibit communications connected to your kidney wellness, blood condition, and psychological health potentially years preceding additional indications manifest. Nearly everybody never discovers what indicators merit recognition. That constitutes my subsequent presentation subject. I'll demonstrate the 4 nail communications meriting inspection this evening. I'm Dr. William Lee. Maintain psychological sharpness, and I'll connect with you subsequently.